Recording in progress.
Before we begin, and before I can actually, sorry, there's been a problem with my screen this morning. Firstly, I'd like to acknowledge country, in particular the lands of the Turrbal and Yagara people on which we all are today. Could I get you, those of you who are online, to pop something into the chat about where you are today and people whose lands that you're working from today, so that Genevieve can see where the mix of people is. And we probably can't see the chat up there, but Linda can tell us. Yeah, for your information, Genevieve, we're a multi-campus university. We are in many places across the nation. So when we do come together, it's a bit of a privilege to know that we're spread across so many lands. But I'd firstly like to respectfully acknowledge the traditional owners and the custodians of all of the lands on which we gather today, and recognise their deep and ongoing connection to this land, its sea, skies and waterways, and the role they continue to play in caring for the country. Our centre, Genevieve, is a centre that really focuses on equity and diversity, and so many of the things that we talk about when we acknowledge where we are central to the work that we're doing. So we pay our respects to those people today. So this is a bit of housekeeping. This is what we're doing today. So I'm just going to talk a little bit about the centre today. Some of that is for people who are new to the centre, as well as for Genevieve's sake about who we are. We're going to listen to our cluster leads then, who are doing 1-minute pitches about what the work that they do within their clusters, and then we're just going to set up some breakout rooms for you to go in and talk some more about the work that you can be doing. We're going to have a bit of a feedback session on Mentimeter that Linda Lorenza is driving, so that we can get a little bit of information about you and potentially what is needed from you, and sort of thinking about yourself in terms of create. And then we're going to look at building a research trajectory. And we have a couple of our experienced and gun researchers coming in to talk about their research trajectories, what that's looked like, and then do a bit of self-reflection. So interactive day, but mostly we are very pleased to have Professor Genevieve Dingle with us today to do our keynote. So this is what we're about, Genevieve. Evidence-based research, innovative approaches to education, equity, inclusion, social cohesion. We operate in many communities across this state and other states within Australia, and we work closely with community and industry partners, mostly around that notion of education and training pathways, but our research really focuses in two different areas, I guess, and one of those is applied arts is a strong focus for our work, as well as education, but other things sit under that as well. So that's a kind of brief description of what we do. And so we deal with these particular research themes that are overarching across the work that all of our clusters do. So these came out of our planning days a couple of years ago, and we were trying to focus in on, like all research centres, you evolve over time. So we're trying to pin down the things that really define what we do. So that, that focus on cohesive communities, improving wellbeing and resilience, inclusive learning environments, and improving communication and problem solving, which goes across all of the different contexts in which we do our research. But sitting around those themes and going in and out of those themes are our research clusters. So education, justice and innovation. And that is led by Corey Bloomfield and Brie Kitt, who are sitting just behind you. And Edgy, as we like to call them, are really looking very much at that focus on equity and education and communities. We also have our applied arts in regional communities cluster, and this is led by Lorenza and Nadia Mead, who's online. And our applied arts is quite a diverse kind of portfolio of work, isn't it? And Linda will talk in a few minutes about, the project that they've been working on. So there's some amazing stuff that's been done in the last 5 years around applied arts. Empower a global education for sustainable futures, led by Karina Menzies-Ballantyne and Trixie James, sitting at the back of the room. And this came out of some very focused work done by Karina and another of our ex-colleagues, and has kind of broadened into a focus is sort of moving towards more of a focus on scholarship, learning, and teaching. That's what we got out of our last couple of planning events. And our digital literacies and pedagogies cluster, led by Robert Vanderberg and Michelle Vanderberg, who's not with us today. And Robert and Michelle are very focused in on that notion of effective learning strategies around the digital and what the affordances of that are. We also have another cluster that sort of sits adjacent to our centre, but also is very active in another one of the big the institutes of research, and that is our Agri-Tech Education and Extension. And so there are some crossovers with us in terms of the work that's done around schools, but all of the work that's done here takes place across many different educational contexts as well. So we're looking at higher ed schooling, private schooling, outside training, those sorts of things. So we've got, quite a spread. I just like the numbers, that's all. We've got 4 members, associate members and affiliate members, and our affiliate members are drawn from a number of different universities. Those are just examples of the breadth, I guess, of involvement. Some of these are people who have worked with us on projects. Some of them are ex-colleagues who've gone out into the world. Some of them have come to us because of the things that we're working. So I guess this bit is just simply about what our strengths are. So research translation is a big thing for us, and in fact it's going to become quite a strong underpinning of the centre going forward. But it reflects the work that we have been doing over several years now, which is that we often do things that result in outputs that are, yes, academic, but also things that serve our communities, serve industries, and that the things that we do in, I guess, in partnership with those groups is to give them those tools that assist them in meeting their outcomes around education, applied arts, etc. So you can see some of the things that we've done there around building micro-credentials, professional development materials, training, toolkits, guidelines. We've done a lot of policy work as well, policy analysis. Recent work that I was involved in, we put together industry guidelines for inclusive assessment practices. So quite a range of things. And then we also have an emphasis on translation into schools and educational facilities. And some of those educational facilities are within CQU itself. So we're talking about, the STEM Central that Linda Pfeiffer, our DDR for School of Ed and the Arts, runs. The Makerspace, which is also, a growing kind of, it's been in place for a while, but it's growing in its reach towards research. Research embedded in communities is one of our strengths as well. We have built networks and relationships and partnerships in communities across Australia. Some of those are quite complex kind of relationships as well. We were very involved in the Regional Arts Services Network for a number of years, and had quite a big project there which involved multiple partners, multiple local government and local community partners. We're looking for those opportunities in communities where we can actually partner with social enterprises in some cases, industry in other cases. So yeah, it's multi-layered. And school networks is one of the things, because we have a strong connection to the School of Education and the Arts. So schools in regional communities and schooling educational centres such as the country university centres are a focus for us too. And in terms of research skills, we have a wide-ranging set of skills across the centre as well, and drawing on qual and quant. But so, you know, a bit of a focus there for some people around that participatory action research as well, and that is a strength of getting, particularly the work that Linda Lorenzo has done, you know, working with different communities to actually solve the problems that are identified for them. And, you know, some strong work, and I imagine we'll probably talk about this at some stage in that youth participatory action research. So a number of different things that we're involved with and do. These are just, if I can get the slides right, these are just some of the key kind of projects that we've been involved with over years, big projects, small projects, predominantly Cat 2 and 3 funding, and an emphasis on contract research as well. So we do a lot of that type of work. But what I would like us to do in the room here is we're going to get some of our cluster leads to come out and just talk a little bit about a particular project that they've been involved with, so you can get that sense of, you know, what those things might involve. Who would like to? All right, I'll go first.
Hello everyone, Linda Lorenzo here from the Applied Arts and Regional Communities Cluster, and I'm so pleased to see that many of our group are here today. Nadia Mead, who's my cluster co-lead, is online, Andrew Cousins, Peter McKenzie and Patty Priest. Just warning you all, you're going to feature later in a little video that I've put together, but not right now.
Look at Patty's face.
Surprise! So look, we do lots of things, and I think key to our cluster is storytelling. And we do storytelling in our research in regional communities. Now, I was actually going to just talk briefly about a grant proposal we put together last year, led by Andrew Cousins for Screen Australia. And we were embracing the Australian government's 2023 National Cultural Policy, a place for every story, a story for every place. And in doing this particular proposal, we were also attempting to poke the bear, to say, hang on a minute, you're in the major metros, you're in Brisbane making all these decisions about us and the people and communities out in the regions. Not surprisingly, we actually weren't successful, but we certainly put that issue on the map for Screen Australia. And so now what we're planning to do is use all of that work that went into that proposal to build some other activities and research activities for the year. Connected to that has come out of some other research that we've done with the Creative Business Champions project in 2022-23 is an idea of looking at people who are what we've called in the cluster trailing spouses. So people who are moving around the country and the regions with their partners. And what my colleagues have found along the way is that many of these people who are these trailing spouses are creatives. They're doing something in the arts, or they're trailing with someone who's doing something in the arts. So that's a project that we're planning to dig into in case you want to join us. Thank you.
Thank you. Excellent. Barry? Sure.
Morning everyone, Corey Bloomfield here from EDGI. I'm here with Dr. Bree Kidd, who's my co-lead, and yeah, we talk about one of our many projects that we work on, and that is one that we've got in partnership through European funding and the Erasmus program, which is in partnership for universities, University of Limerick and Ireland, Inland Norway Uni, and also LUMSA in Italy as well. And what we're looking at doing, and have been over the past 2 years, we're in the final year of the project now, is being able to develop accessible learning for those who need to be reskilling, developing their employability skills, and also their self-efficacy and belief in themselves as learners to be able to re-enter the workforce in very changing, different sort of regional settings. So for us at CQ University, our focus is with young people who have disengaged from formal learning, dropped out of high school. That's those sort of groups of kids who are in training organisations, doing Get Set for Work programs, and being able to support them with developing their belief that they can learn and the skills to be able to learn online. So really being able to understand that regardless of whether they're going for a job at Red Rooster or wanting to come into formal education, going back to TAFE or university, being able to work online independently is a skill that everyone needs these days. So that's what we're working at the moment. We're trialling with a local provider in Northampton. And yeah, we're working on that as a team there. It's been really great the way that we've been able to bring in members to the team, whether they be very much active researchers and then also teaching scholars who have a lot of value, particularly in being able to think about how we might ensure that the learning opportunities are, from an education neuroscience perspective, very brain friendly, and being able to then relate that to how young people prefer to learn. So we're going through that pilot now and getting the feedback from young people to see what they think about how we're working and how we might refine it. So
Thank you.
there's one of the many. We'll obviously talk about that and other projects more when we meet later in the day.
And the symposium? What?
Okay.
Because they're online. She's online.
Oh,
Chappelle's online.
Dr. Hall, you're online. Lovely to, I can't see your video, but lovely to see you. So we're also lucky to have Associate Professor Chevelle Hall from Virginia State University as well. Chevelle, if you would like to say hi, please do. But yeah, hopefully the snow isn't too bad where you are. I'm assuming you're probably stowed in. But yeah, we'll be hosting a Education Justice Symposium on our Rockhampton campus in August this year. And that's in partnership with Virginia State University and their Justice Institute as well. So yeah, really exciting. Linda Lorenzo and I will be sort of the driving force in that, with a lot of support from Create and others within the university as well. So very much looking forward to that opportunity. Thank you.
Thank you.
Hello, everybody. Feels odd staring up here at the computer. My name is Trixie James. I'm co-lead with Dr. Karina Menzies-Valentine on the Empower Cluster. And our Empower Cluster is sort of having a little bit of a slight change in our purpose and our vision in the coming years. However, what we have is a very multidisciplinary cluster with quite a breadth of people involved, from PhD students through to different academics. And anyway, I thought what I'd do today is just share on a project that just shows how vast some of ours are, because whilst we have a global sort of perspective as well, what we're looking at is really looking at reimagining education for all. And the project that started out as just a very, very simple little little program that we want to develop within our School of Access Education was called the Be Positive program. And from that little pilot, developing it through COVID, that was our fun sit-at-home activity that we were doing. We developed this program and had piloted it. And what's actually happened now is we're starting to see growth happen in this area. So we're redeveloping it now. So not only is it embedded in universities and throughout a number of middle courses, we're now looking at redesigning it to go into middle schools. So the same type of idea, but developing the programs, we're taking it to middle schools and piloting it, and then hoping then to expand into a bigger external grant later this year into next year to take it out further afield right across education. And then even from that idea has sparked something in one of our colleagues who's decided to develop it to be positive about maths. And so she's actually now developed this little project, but also we're using it now to embed into other ideas that initiatives that we're running out. So basically this little idea is sort of to show that, you can start with a spark and it just starts somewhere small, but it can grow. And that's where our cluster wants to step in and help people to start their ideas and then see how they can grow and progress, into different grants and into different opportunities. But we'll be talking more about our idea and how we're going to expand.
Thank you, Trixie. Robert, do you have anything? Yep. Okay. Margaret, teach me about it. You just about it. No? Good.
so we were all walking. I was in the back. So my wife is currently flying back to America, so I'm just here solo. But we are the DLP cluster, and we really work in digital literacies and pedagogy. And probably one of the strengths of our framework is we don't have content area specific. So we're currently 2 projects. One, we're currently working with mathematics. In Australia, students have to take this test called the LandTite to be certified as teachers. So we got a $200,000 grant last year funded to use our IDP to help students prepare for the LandTite. We used about 200 students in the study and found really high success rates. What we did was try to compare it against traditional tutoring. See, if we just tutor students, if we have this software that kind of individualizes their plan and sets it up, and what we found was we were significantly higher in preparing students in mathematics, but equal in English. It was kind of an interesting result because then we could basically say we can help students be successful in regional remote areas and places where they're struggling, where they might not be able to get individualized one-on-one tutoring, and we get this pedagogy to help them be successful. So that grant was a powerful project. We're currently using the EDP as well with accounting. We've used it with nursing. We can use it in any content area. So it's a neat construct. I'm also bringing a gentleman on. His name is Sadia. He's a tech guy. He basically started a tech company, got bought out, and then said, I don't want to do anything. And he contacted me, and we're looking at adding AI to the IDP to make it even more specific and more interactive with the students to making it better. My wife brings along the literacy side. So we really also work with programs helping people develop their literacy in either AI or other digital pedagogies or digital constructs. But that's our last couple of big projects. And you can come visit during my session. So,
Joe, do you want me to?
because you were on my screen, and then when I was up there, you were up there. Everywhere.
I just messaged him and said to get downstairs.
Totally. I should have just got like a stand aid that I could put in my computer.
Sorry, everybody. Sorry. My name's Margaret Kettle. Hello. I've just arrived a little bit late. Sorry. So I'm a research professor within Create, and so lovely to meet you. Say hello to colleagues who are elsewhere. So I'm a bit of a new arrival at CQU. I've been here 3 years, and I think the thing that's really great about, one of Australia's biggest regional universities is that I think issues like diversity, inclusion are much more foregrounded. There's much more heterogeneity, I think, and they're much more sort of obvious in regional communities. So that's actually a very exciting space to work in. So also, hello, Chevelle. So a project, I suppose, that I think really highlights that is my background is applied linguistics. I teach a lot around language. Anything about language I'm going to be excited by. So my brief really is to bring as many people in Create onto projects as possible, which I've, endeavoured to do in the last 3 years. But one of the projects was a Scanlan. So this is a philanthropic, and I know I did my PhD at UQ, so I know that ARCs are really front of mind. But this is a philanthropic, which is a very interesting funder. And this was Scanlan, which is interested in migrants, and settlement in regional areas is massive. Often hidden, often invisible, but some of the big regional centres where we have campuses are where humanitarian settlement is really going on. This was a project around literacy, English language literacy for refugee background women. So very much a participatory project working with community organisations. The outcomes of that have been increased social engagement, increased English language proficiency, increased knowledge about schooling and the processes of schooling, because a lot of refugee women, there's some very interesting sort of life experiences,
as they are very much responsible for the domestic domain, they're at home, their English proficiency doesn't increase, and they often can get ostracised by their families. So we need to get them out of the house, we need to get them learning English, and we need to get them familiar with schooling processes, because many of them haven't actually had schooling themselves. Many of them don't have literacy in their home language. So this project was about engaging with all of those factors, working with community hubs in a regional centre, and then coming up with 2 books, one for the Yazidi community, which speaks Kurdish Kurmanji, they're kind of ethnically Kurdish, and have a non-written language. So we couldn't write a book in their language because their language isn't written. So they wanted it written in English, so it's very pre-literacy English, and it's a story about schooling in Iraq and Australia, which really they wanted their children to know about schooling in Iraq because many of their children have been born here. The other book is a trilingual book in that it was developed with African women, and it's a story about schooling because these women haven't been to school themselves. They don't know the scripts of schooling. They don't know that your child needs a clean uniform every day, that what you sleep in and what you go to school in is different, that you need lunch, that you need a water bottle, all these kind of things. So there's this kind of, these are the processes of schooling, these are the processes of learning English. We've got Dinka, Swahili and Arabic texts so that they can understand what the English is saying for those who are literate in those languages. So these books have been widely celebrated. I'm just getting some more printed because a whole lot of the public libraries want them as well. So that's just an example of, I think, a kind of project that really happens very comfortably in regional settings. That's it.
Good point. With that, just thought I'd flash that up because that just shows the breadth of our partnerships and relationships that we've enjoyed over the last 4 or 5 years. So we work, obviously, Genevieve, really widely with institutions, but community organisations as well, and wide-ranging funding there too. So that's just by bragging. We've just said bragging. We've just had planning days, and so this is mostly, I guess, for the creatives. That these are the things that we're going to be looking very closely at this year. Coming together around grants, infrastructure, support from the university, guidelines for a number of different things and strategies that we've got to develop that will better support the work that everybody's trying to do within the sector. But I just thought I'd say this is what we've done the last 2 days. We have been working. But yes, that's all about us. Now we'll get Linda to introduce Genevieve.
Should have asked to go first because now you've totally psyched me out. I'm like, oh, I don't want to share that. Oh, one small thing. I'm in the right place.
Yeah. You're looking at
I'm just looking generally out there to the vast audience that is with us today because this room's a bit confusing for me. It's not a theatre, which is usually our campus in Mackay. Anyway, I'm very excited today about our guest speaker. Our keynote speaker today knows the best medicine isn't always found in a pill bottle. Sometimes it's found in a song, a garden or a community. Professor Genevieve Dingle is a clinical psychologist at the University of Queensland and affiliate professor at Nottingham Trent University in the UK. Her work is reshaping how we think about mental health, moving beyond the clinical and into the creative, the social and the everyday. Genevieve is a key voice in the Australian Social Prescribing Institute of Research and Education, ASPIRE. She is championing the importance of the social determinants of health and the transformative power of social prescribing, from the value of community choirs to the role of urban design. All factors in creating flourishing, livable, sustainable communities. Genevieve's message is clear. We must reconnect people to their communities and activate and design communities that help people to flourish. I hope that's correct. Genevieve has led major ARC funded trials on loneliness and social isolation. She's chair of the Arts and Culture on Prescription panel at Aspire and is associate editor of the Journal of Psychology of Music. Her research is bringing rigorous science to the spaces where community and wellbeing meet. So today, in implementing and evaluating social prescribing in regional and rural areas of Queensland, Genevieve will take us inside two major Queensland trials. She'll share real-world challenges and wins of getting social prescribing to work on the ground across diverse communities and in interdisciplinary teams. So please join me in welcoming Professor Genevieve Dingle.
Yeah, am I in the right
You
place?
are.
If I go here. Okay.
So
Thank you so much for the invitation and the warm introduction. I feel like I'm amongst my people here. Probably should just say a little bit about my background. So I grew up in Gatton, if you know it, Lockie Valley. So I'm a rural kid myself. And I'm public school educated. I'm very interested in student equity and student wellbeing. So I could have probably done a completely different talk about my digital student wellbeing work, but here we are. So lovely to have this opportunity to share a little bit of some of the things that I've been working on. Also probably important to say that I'm a clinical psychologist by training, and I have worked for over a decade in sort of hospital and health traditional psychology roles. But my background is both science and arts. I've got a science degree and arts degree, and I find that the most exciting work happens when you bring those things together. And you're talking to an interdisciplinary project team or audience like yourself. So I've sort of swayed quite a long way across from my traditional training into some of the work that I'm doing now. So I'm pointing at you when I
I'm the one, yeah.
Yeah, thank you. So I did also want to echo the earlier acknowledgement of country. So I also live and work on, in Meanjin, and so I'd like to, on behalf of the University of Queensland, pay my respects to the traditional custodians and their elders past and present. So that was that one. This is our reconciliation artwork for the University of Queensland, which I really love. All right, so a bit of an overview of this session. First of all, I'm going to talk about unmet social needs and why they're really important for us to talk about in terms of the knock-on effects on health and wellbeing. Secondly, I'll introduce this idea of social prescribing, which is still quite new to most people. So some definitions and some working models of social prescribing. Then we'll look a little bit about the evidence. So I'll share mainly the results from Brisbane North Primary Health Network trial, which is quite regional, big regional area to the north of Brisbane. But I'll also touch on the current Queensland-wide trial that's in 10 sites across everywhere in Queensland, rural, remote, and also some metropolitan sites. And then I'll talk about some learnings, some challenges and successes that are coming out of that last 6 or 7 years of work there. Okay, so I wanted to start by sort of focusing on this fact, which is that the top 10% of GP appointments, attenders are being taken up 30 to 50% of appointments. So these are known as the frequent attenders. So what's happening here is that they often do have quite complicated health and mental health needs, but they're attending a lot of times not to get more medical care. They're attending because they have to be seen. They often can be bulk billed, and it's someone that is listening to them. So we're talking about unmet social needs. Sorry. Okay, and so thinking about unmet social needs in one or more of those social determinants of health domains, which I know I'm not speaking to anyone who doesn't know this stuff. This is a nice infographic from the Australian Institute for Health and Wellbeing. You're talking about people who have potentially underemployment or unemployment. They've got low incomes. They've got maybe unstable housing. They may be in contact with the justice system. They may have domestic family violence. They may have just other reasons why they're not earning much money. So they're not able to access a lot of the sort of more choice and privatised options in terms of health and social care. What I'm sort of anchoring on here is the social connection. angle because loneliness and social isolation happens across all of those other domains. People get marginalised, there's stigma, there's shame, and they don't come forward to accept the kinds of support that perhaps other people are accessing. Thank you. So actually loneliness has become part of much bigger conversation worldwide. You may have noticed yourself about ideas about the epidemic of loneliness, this sort of thing. And the World Health Organization has finally really positioned it front and centre. So they've got a commission at the moment on social connection, which aims to see this issue recognised and resourced as a public health priority. Now we're about halfway through the tenure of that commission, and they released this report at the end of last year, which is available on the link online, which really summarises all of the evidence around the detrimental impact of social isolation and loneliness for health, wellbeing, quality of life, and then all of the different types of programs and interventions that have been designed to address this problem. So some of those are individual things, like even therapy, but in my mind, the most interesting parts are the social and community embedded responses to isolation. Thinking about our area of the world, Australia, we have a very widely dispersed population. So people living in rural areas are actually lonelier on average than people living in the metro areas. Also, an estimated 10% of Australians live in outer regional and remote areas where there's pronounced isolation due to just sparse living situations, sparse assets and infrastructure. So that puts them at then an increased risk of actually being away from things that they'd like to be able to access. So I've written a chapter which is just coming out shortly with Leah Sharman, which is talking about loneliness in the Australian context and the fact that we really need to mobilise these community-based resources to enhance connectedness across communities, thriving communities. And I think there's a lot of wisdom in communities, and I'm not telling you guys anything that you don't know that we can actually bring to this, this issue. So that brings me to social prescribing. Social prescribing has been defined as a non-medical approach or health pathway in which patients are referred to social activities and social services in the community that improve their health and wellbeing through that mobilisation of community-based activities and people and resources. So this little photo that I found online is really to indicate the person with the interviewing board is a link worker or community connector person, and they're talking to a client who's been feeling, isolated, and they're trying to get to know each other. And the key part about this conversation that is a bit of a contrast with the average conversation with a health worker or a GP is that they're not starting with what's the matter with you, tell me about your symptoms and we'll make a diagnosis and a treatment plan. They're saying what matters to you, what interests you, what could be available that might meet that need, either locally or perhaps online if there isn't anything locally. So it's a different quality of that information and engagement. So there are different models of social prescribing. These are the three sort of broad models. The light model is more like signposting. So this might be where GP, health professional, community worker will come into contact with a client who is obviously isolated, and they'll sort of know about, oh, there's a community garden down the road, or there's a choir in this hall, or there's, a mothers and babies group over here, and they might signpost that or give them a brochure or some information about that. But that's pretty much the end of it. So when that happens, the problem is there's no follow through. So you don't know if they've actually gone to that thing and tried it out. They may not be back for another appointment within a certain time frame. So you don't really know how successful that model will be. That's probably the most things that people are doing at the moment. The medium sort of model is where a health facilitator would provide extra level of support, particularly around sort of engaging in health behaviours, but also might, signpost voluntary or support groups, that sort of thing. Most of what I'm talking about for the rest of this little talk is the holistic or full model, where there's an actual dedicated person or a link worker, community connected person that is very much part of the overall social prescribing pathway. So how it looks in the UK model, which is probably the one that we know the most about and has been sort of established for the longest, is that the GP or primary health worker is referring their patient to the link worker. They'll have a number of discussions. They will find out what the needs and interests and barriers are. They will help to remove those. They'll find, community programs that suit that person's needs. They may even go with them to get them through the door. They will follow up. How did that go for you? Was that a good fit or not for you? Let's have another look. Let's go back. So there's a lot of follow-up and feedback going on in that holistic model. So this is an infographic that Leah Sharman did for one of our reports, which shows the adult version of a full model of social prescribing. So as I said, there's the lonely person, or someone's recognising they've got an isolated person. They make a referral to the link worker. They'll co-design a plan, a social plan together. They'll connect them to groups and services in the community, and they'll follow up. So there may be a number of different meetings over a period of time. So just a little quick word on referral sources. Again, because in the UK, everything was funded through the NHS, so it's a very primary care driven model. And all of those link workers were funded to sit within GP surgery. So it's a very medical driven sort of model. In Australia and in other jurisdictions, it's much more diverse. So actually we have referral pathways that are coming from community centres or from other community organisations. We also have a lot of self-referrals, so people who actually find out about something online or in their community notice board and they'll sort of say, I'm kind of interested, tell me more about this. We still, across the globe, have much more information in terms of evidence for adults who who are going through it themselves rather than for young people. So there was a real kind of missing group there of families, young people and adolescents who also had very high levels of loneliness, particularly adolescents. So there really wasn't a lot known. We do know, however, that we need a different kind of model. Adolescents tend not to just rock up to a GP, for instance, if they're having problems. They'll go to a friend or online. So we needed to have something different for that different age groups. Okay, so just a little bit on the evidence, if it works and does it work here in our context. So this is some results from a 2-year trial of the Brisbane North PHN funded social prescribing trial. So this one, so PHNs, there's all of the PHN regions across Australia. They have a certain amount of discretionary funding where they decide in their area with all their GP practices, what are our key priorities that we want to do programs around. Brisbane North had a big key area about loneliness and social isolation and social prescribing. And we were brought in as contracts with evaluation. So this is led by Leah Sharman on the left and also with Natalie Jones in the middle and myself. So this trial was operated through Footprints Community, and so they had the link workers and they're still running. So their program brochure there is Social Health Connect. You can still find information about that online. And then we had training sessions with the link workers to tell them about the research and the evaluation, and they were collecting the data from their participants. So this isn't published in a scholarly journal yet, but the 2-year report is available and it's online. You can ask me if you can't find it. Just to sort of say how huge this region actually is. So if you can see the red outline, it's quite a large area to the sort of northwest of Brisbane. It goes out to Kilcoy and sort of farming land around there. It's also Caboolture and it goes across to Redcliffe and Bribie. So it's quite a large and sort of mixed area. If you can see the sort of flow infographic there, on the left-hand side is all the referrals, so people who were referred to the link workers as part of this social prescribing, and on the right is the people who actually accepted the referral. So sometimes the people referred didn't really understand what it was about. Sometimes they never answered the phone for the link workers, so they just weren't able to make the contact. But you can see overall the actual demographics are pretty similar in the 2 samples. So we've got a representative subsample that actually engaged with link workers. Just a few highlights there. We've got, a reasonably even split across male, female, obviously much fewer of non-binary. We've got a small minority of LGBTQIA plus identified folk. We've got a group of Indigenous folk. We've got some culturally diverse background participants. So in these tables, which I'm sorry are a little bit busy, On the left is the referral sources. So again, this just tells the story that these are not all coming from health or from GP and primary health. Even though this is a PHN funded trial, you would expect that a majority were coming from GPs. But what this is showing us is that a lot of them were actually coming from hospital discharge, so hospital and health services. A lot of them were self-referred, and a big group were coming from other community services. So that's where people are presenting. And those people, if they know, can send them through to Footprints to be involved in this kind of program. They're quite diverse. On the right-hand side, this is telling you about what are the barriers that stop people just going along to the community garden or the choir or the mums and babies club, because those things are already there in the community. So sort of it's a question about, well, why aren't people just going? Really big reasons why people don't go. So top of the reasons is mental health issues, physical health issues, but then all of those social determinants of health coming in. So financial stress. So even with a low cost thing where it's, $20 a time, that's going to put people off who have got a, low income. Unstable intimate partner sort of relationship, having caring responsibilities where you can't bring your young person with you to whatever the program is. And then there's psychological barriers. So that we actually found in a few different trials. I haven't shown you the earlier trial, which was an adult trial in South East Queensland. One of the biggest barriers were not actually structural like transport and cost. It was, I know there's a group I can go to, I know how to get there on the bus, but I think people will judge me, I'm not walking through the door, I won't be like them. So those psychological barriers are really strong deterrents for people to go and just give it a go. And those are the very things that the lead worker who's skilled can really help to overcome, just to get people in and feeling safe and comfortable. Cultural or religious reasons, language barriers, walking into a group that you're interested in, that is local, that you can get to, but you're the only Pacific person in the room. So we did have that sort of feedback. You have to feel that this is people like me. So lots of barriers to overcome. Thanks. But does it work? Absolutely, it works. And so this is just some selected outcomes from that 2-year report. On the first graph on the left, this is people's rated satisfaction with the biopsychosocial types of care. So physical health, psychological health and social all were far more or significantly more satisfied with those by exit of the trial. In the middle there, we've got the loneliness and social isolation, which also decreased significantly from pre to post. On the right-hand side, you've got different sorts of social factors. So readiness to join groups went up, trust in others went up. Pretty much everything except social support given, because it was already quite high at baseline, so there wasn't much change there. But everything else was sort of going from low to point by the end. So very promising results for the folk that didn't engage with that program. So that brings me to the current trial, the Queensland-wide trial for social prescribing for families and young people aged 0 to 18 years, and it's running through 10 neighbourhood and community centres all around Queensland. So this was funded from the state government Department of Families through the community service community centres. The contract research, so the contract went to Aspire, and then I'm leading the UQ team that's subcontracted to Aspire to do the evaluation protocol, so it's a little bit complicated. So what we've got at the top here is my attempts of doing digital art, which I probably need some Canva skills, but anyway. Basically what happened is that there was quite a long delay before we could start collecting any baseline data, partly because most people in those areas had never heard of social prescribing, they didn't know what a link worker was. So the link workers had to go out and about and form those trusted relationships with the stakeholders, the referrers first. So, going out and talking to doctors and, health professionals and teachers and early childhood educators and people in the community that offered these sorts of social activities, all of that had to be working first before anyone was going to, send their clients across. And then there was the social prescribing piece. So you've got all the people being referred from all the different angles into the community service, talking a number of times with the link worker, developing a plan. It may be more than one member of the same family. It might just be the parents bringing their school-age child. Could be a teenager brings themselves. So a whole range of different sort of conversations there, and then they're working together to find a community group that's going to be inclusive and supportive and engaging for them, which could be a whole range of different types of things. Thank you. So we're only 7 months into this trial, so I actually don't have lots of results to show you, but I've got learnings early. So these are some of the things that the young ones were saying about themselves. So here we've got a 10-year-old girl who says, I'm nervous about meeting new people and trying new things. We had a lot of that kind of comment at the pre-baseline. 11-year-old boy saying, I'm nervous that my friends will leave school. You know, so if you're that kid that's got the one or two friends, you just don't want them to leave, you know. On the right-hand side, you've got some more structural sort of barriers here. So 11-year-old girl saying, I live in a small neighbourhood, there are no kids my age near us. Or a 10-year-old girl saying, I live around elderly couples, there are not many kids or playgrounds here. So where would you gather to just incidentally run into other kids your age? So it's a bit of both. In terms of the early interviews with link workers, people saying what kind of social program they'd be interested in, social activity they'd be interested in joining. Interesting that the biggest chunk were interested in some kind of social emotional wellbeing program, which is a reflection on the fact that we've got a really big engagement from First Nations family in this trial. We've got a fair chunk who are interested in doing some kind of musical arts or culture type group. We've got a reasonable chunk who want to do some parent and child groups. We've got a reasonable chunk who want to do something more physical activity, leisure, outdoor activities. And then a smaller group that want to do something in nature. So again, this is very early data and it may well shift because we've got a fair way to go, but it just gives you a flavour of what people are thinking about. The methods are quite complicated here. So we've got lots of different types of data coming in. We've got the link workers implementation level data. So there's a line in their worksheet for every person that's presenting, just so we can get all those social equity and demographic kind of details at the family level. Then we've got self-reported surveys, so pre and 12 weeks and 6 months. And this is only, of course, for the people who consented to be part of the research, so that's a subgroup. We've got health economic analysis going on, so we've also got costings both from the government that are funding, you know, the positions and the resourcing, and we've also got some of those quality of life measures that can have values attached to them. And then we've got a qualitative component where people are telling their stories, and then we're looking at qualitative methods for that. So quite a lot of data coming at us, and we're trying to sort through that and make sense of that at the moment. So some of the challenges that we already can sort of reflect on is that first part that I said, it took a really long time, much longer than we expected for any data to flow, because of the lack of social infrastructure and understanding and promotion of the idea of social prescribing in a lot of those places. Also, these link workers were newly employed for this trial. So even the link workers themselves, and I've done some of their interviews, have said, I had no clue what it was. So I had to look it up before I applied for the job. So even they are starting from a fairly, starting point. Then lack of that social infrastructure, those trusted relationships with other providers in the area. So if you turn up in an area with a chunk of money from the government, other people in the area are going to go, well, why did we get that money? Why would I send my people to you? And you're going to walk off with my people. So you've got to really kind of be clear about, you're not treading on toes. This is my role. This is how I can help you do your role, etc. There may be fewer free community things in those areas. So there may be lots of great things in the area, but there might all be like, the music teacher who has their studio, or the class that does this, or the gym, but you have to pay for those. So if you're looking for those low cost or free activities that people can access, you have to be sort of quite creative to find those opportunities. We're also trying to link in with existing programs in those rural and regional areas. So Arts Queensland have funded a number of those regional sort of programs. The Play on Sports vouchers that are also funded. Health and Wellbeing Queensland have community wellbeing grants. So it's hard to find, there's no central repository of these things. So the link workers have actually got to dig out, is there something in my area, where do I find those people? And you've mentioned local council will have a lot of things. If there's a local library, you're winning. So there's hubs that you look for that are running different programs. Okay, as a research evaluator, it's also really strenuous because we didn't have any researchers on the ground. We had link workers and we were trying to train the link workers to be researchers, and I don't think any of them had a research background. So for them, it's all red tape. It's all just a lot of admin they have to do, and we're particularly happy about it. So we had to get them engaged with, this is a trial. You know, we need to have evidence, and you're a really important part of that evidence growing. The other part was a lot of the self-reported survey data was coming into an online Qualtrics software system, which of course means that once they've sent the link to their participant, they don't know if they've completed or not because we can see it, but they can't see it. So a lot of that having to feed back a lot of information gets quite busy with the 10 sites. The other thing is that we've got all these different age groups that are involved in this trial. So you've got really different measures and methods that you can use with the young ones. So it's going to be parent proxy report for the 2 to 7 year olds. Then you've got the primary school age who've got some child versions of things to report. And then you've got your youth and adults who can self-report. But then you can't merge that data because they're all different. So all of that's quite challenging. All right. Successes and lessons learned. Well, the link workers have been tremendous. So they've done a number of different community of practice sort of meetings and workshops, and they've come to Brisbane for a few of those. They've been really creative about trying to find bespoke things that are going to be helpful to the person that's saying, well, I'm really interested in Dungeons and Dragons or whatever it is. Okay, great. The early data, and as I say, I haven't got hard numbers yet for you because we're still getting that interim report out, but we are seeing that it's reaching the people who most need it. So we've got people here who've got all of the equity kind of backgrounds. They've definitely got elevated loneliness. They've got low community inclusion. They're experiencing multiple social determinants of health. So it's great news because we are actually reaching those people who often don't come to, GPs and other sort of services. And just sort of one quick dot point that the preliminary baseline to 12-week results are looking really positive. And as I say, the interim report is due in mid-March, so I'll be able to sort of speak more publicly about that in a little while. One thing I'd like to say about all of the social prescribing projects that I've been involved with is that it's not a program, it's not a thing. It's very complex and sort of bespoke, not a one-size-fits-all, which makes it quite hard to summarise and to show the evidence because each person's doing it for different lengths of time and different types of things. But it is highly relational. So this is a paper that was published out of the earlier South East Queensland trial, which really looked at the relationships that were built between the service providers in their community, and then between the link workers and the incoming client, and then the clients within the activity group and the facilitator of the activity group. All of those things were highly predictive of outcomes. So you've got to have those trusted relationships in place for the person to stick, if you like, with that community group, where now they're going to have a whole lot of resources, psychosocial resources open to them. Yeah, and so a little bit more about why we think the groups are important as opposed to, say, doing an individual online thing about, lonely thoughts or something. So I work with a number of social psych people who are using this social identity framework. So it has come from an intergroup perspective. It's been used in sort of big scale, when people are at war with each other, all the way through to workplace teams. And now we're looking at it in the health and wellbeing sort of context. According to this theory, and there's lots and lots of evidence around it, if you embed yourself in a group or community and you really start to identify with that community, so we might say, we're academics, say, so that's a social identity that comes with being part of this community, then you start to be able to take on board the behaviours and attitudes and values of that group and you espouse those yourself. So putting that into a health context, if you join a group and you feel really strongly identified with that group and the group norm is to be really heavy drug users or something like that, you're much more likely to take on that behaviour because it's normative within your group. Similar, if you're trying to change that behaviour, you need to actually think about your social connections and the groups that you've identified with. So you can use that idea as part of your intervention. So with this sort of thing and with some of the previous arts-based groups, so choir and health and wellbeing sort of groups, to the extent that you have been a person who primarily sees yourself as, say, a person with schizophrenia, and you go and join the upbeat arts choir, and now you see yourself as a tenor, that's a really different identity that you're working with, and you've got this group around you that expect you to show up because you've got to hold that tenor line, and they're going to look for you if you don't come for a few weeks. And you've got to actually keep yourself fit, and you've got to be out of bed, and you've got to be prepared, and you've got your lung health and your posture and all of those things. They're kind of surreptitious health benefits of being a member of this trusted group. So it's quite an interesting sort of idea of how we do health through an arts or through, you know, some other non-clinical pathway. So for me, it's all about the group and community. Thank you. I think that might be, okay, where to from here? So if we find that this current Queensland-wide trial is successful and represents a good value in terms of the economic analysis, it will then hopefully support the wider rollout through other, because there's 170 odd community centres around Queensland. This is only in 10 of them. It will really provide much needed evidence for the family and child and youth sort of end of the age span, because so far most of the work has been done with adults. It will also provide evidence for people who live in out of the metropolitan area and who are not from the weird background, so people who are culturally diverse and First Nations. So we don't know much about them at the moment. It will address this loneliness and social isolation, which, as I say, has been really platformed as a major public health priority, and it will hopefully relieve some pressure on mental health services in regional and rural Queensland, which is all in the media. I actually think that if we think the answer to mental health crisis is more one-on-one psychology services, then we're never going to get there. And there's a lot of other ways of doing mental health. So I think we really need to open it up to thinking about these amazing assets in the community that we can really harness to this. So that's it from me. Thank you so much again for the invitation, and I'd really love to have questions and discussion.
Maybe if people do have questions, if you want to raise a hand in the room or raise a hand online, and I can see they're already hands, so I don't have to jump in first with questions.
Should I stand?
So what would you like to do? Would you like to
in the
chair?
chat already from Jay.
Yeah.
Okay.
I'll stand if it's easy.
Well, you can grab that chair if you want to sit down, Genevieve.
Yeah.
A bit more relaxed.
It's a chair on wheels.
Yeah.
Okay, so we might start with Andrew, and then if we jump to Jay's comment online, and then to Corey, and then I'll go for the next three after that.
I've just got a really basic, probably very simple question. So on your pie chart, you had the social emotional well-being activity. Can you just give me a sense of how that differs from like an arts and culture or like the other kinds of activities? Like, what does that consist of?
The quick answer is I don't know, because I haven't had a chance to really unpack what is actually happening in these programs on the ground yet. So we're not collecting a lot of data at the group individual, the group activity level. So I'd have to go back to those link workers and say, well, what was in that program? What were they actually doing? So my understanding is that that would be First Nations-led sort of empowerment program of some sort, which may well have elements of those other things, nature and arts and sort of activity. So, but it might be more important to them that it's First Nations-led.
Yeah, or the well-being is foregrounded as the purpose of the activity
Yeah.
rather than being a...
About arts, skill. Yeah, that's right.
We have a lovely comment from Jay. Jay, did you want to speak for your comment?
Hello. Thank you very much, Genevieve. That was a really good talk. And I just wanted to say, from a personal perspective, recovering from burnout, it was strange to have my GP write on a prescription pad 2 weeks in a rainforest, get a puppy and go on a park run. But I drew the line at park run, so I got 2 dogs instead and joined the local puppy obedience school. So my original PhD work was in spiritual health and well-being, and I can see as a dimension of health, the spiritual health, that holistic way of looking at human beings in their social context is, yeah, it's beautiful work.
Yeah, and as a health person, it takes you back to your roots, really, because in the age of managed care, and you've got 8 minutes with the person or 50 minutes with the person, and you've got to build them with these numbers, it really does dehumanize that sort of process a lot. Just on that though, sometimes we've had feedback, and there's certainly feedback in the research, that being given a prescription for a social thing, if you're not ready for it, you don't understand it, can be seen as a bit of a get out of my waiting room sort of attempt. So I think it has to be messaged really well. And there is so the Royal College of GPs has a social prescribing special interest group. So there's more and more GPs going to these conferences, finding out about the evidence, understanding how do I pitch this so that my patient won't feel like I'm not listening. Because a lot of people go to the GP still expecting to get tablets, let's face it. So being said to get a puppy might not quite fit what their expectations are.
Yeah.
So it's all about
a very big rapport. Yeah, it was the relationship with my GP over a very long period of time before she.
And so the trust was there. And I think that makes such a difference.
Yeah, good. Excellent work. Thank you very much for sharing it with us.
Thank you.
Sorry, Corey. Corey was next, and then Linda.
Thanks, Genevieve. Yeah, jam-packed with lots of information there. Thank you so much. And a lot that I'll share on with a regional engagement committee that we have, that a couple of members actually initiated an end loneliness project. So they'll be very interested in that.
And are you in Rocky? Or
Yes, yeah.
So one of our most active link workers is in Yapoon. So if that's not too far, I mean, I've been up there myself, but in that region, and if it's child and family, obviously, that Jamie at Yapoon is fantastic. So
no, that's great. That's good to know. Definitely.
And also similarly, someone mentioned Razin before. Topology have done a lot of work with Razin, so it's a music group that does a lot of community and up north, out west. They've just been last week, I think, to Emu Park, which is where the singing ship is, and so they're doing community consultation around some sort of community music making around the story of the singing ship. So there's things that people can get involved in that region if that's their interest.
Sure. So I just have a question though as well. You were talking around how, particularly in the UK, the link workers come from a very much health perspective, which is understandable, the funding bodies there and that. Have you found there was any sort of interaction with the social pedagogy practitioners who come from more of that social work sort of perspective? Is that crossover? Because I could see a lot of the
so my understanding is that people doing, so they've sort of devolved into lots of different roles. So some are link worker roles, some are more health coach type roles where they're doing perhaps more motivational interviewing around health behaviours. And then there's more social care type roles, which, a social worker could actually be in any of those roles. Community development sort of training is obviously a huge bonus for this sort of thing. If you're coming from a registered health background, the community development work is quite new, so people feel a little bit like we're allowed to go and just out there and talk to people with so I think everyone comes with their different skill set and their different sorts of training and qualifications, and it's a great mixing pot. I've had a number of conversations or presentations where people have said, well, shouldn't we be training people and having standards of this and that, whatever? And kind of yes, but at the same time, I would be really reluctant to have this become another health regulated thing, because we've already got a shortage of health regulated people out there. And honestly, it's a relational thing. If you've got someone who understands their community and has good relationship skills, they can be trained to be a link worker. I don't think you need to be a qualified psychologist, social worker to do that job. And in fact, those people are needed in their job. So that would be my kind of thoughts, that there can be better support and training for sure. And there's a lot of people who are developing modular type of training. So Take Queensland's got some, Aspire have got some, there's other groups that have got some. And there's, of course, the National Academy of Social Prescribing in the UK. I've got a lot of free online training for link workers. But yeah, I don't think we want to over-regulate that workforce, because they need to be grounded in communities. I don't know. I think I went off on my own soapbox there.
If we could go to Linda, and then we've got a question too from Kate from Marshall Online. Linda.
Oh, I was going to ask where the 10 sites were, but I remembered you had the map there. But
Oh no, so the map was the Brisbane North.
Oh,
and the
sorry,
10
so where were the
sites-
10 sites?
Okay, so let me try and remember them all. So starting in the southeast corner, we've got Oxford, we've got Inala, we've got going up the coast, we've got Deception Bay, Yeppoon, Mareeba, Wilson Heights outside Toowoomba, Blackburn. So there's 10. I can send an email.
yeah, no, I've been working with, I'm on the leadership group with Gladstone Region in Action Together. So it's a Stronger Places, Stronger People project. I don't know if you've heard of it. They're all around Australia, but I was just thinking how this really links in with the work that they're trying to do in communities.
And there's lots of sort of initiatives and community-led things, and there's also lots of community centres that are not part of this trial, obviously, because they've started off through a different pathway for adults. So I think if you're on the Department of Communities website and you look up social prescribing, you'll see, you know, there's a big list there. And 10 of them are these, but there's lots of other ones.
Yeah.
But then local councils, other groups.
Yeah, I don't know that they have these link workers that you're talking about, which is they're
Well,
spending a lot of money on.
the induction. You need the injection of funding to fund the link work, and unfortunately, in every project I've evaluated, it's always been short term. You know, it's like it's a trial, so you've got 18 months or 2 years, which is not great for anyone's job. You know, to sort of go, I'm going to put all this stuff, you know, get it all going from the ground up, and then I may not have a job next year. So it's short-termism is always a bit of an issue.
Yeah, the Gladstone Region Together is 10 years. Project. It's 10 million, I think, 10 years. And I don't know exactly what there's. I mean, they've got a lot of staff linking people, but they don't not doing all of this. So
Right. Okay.
it'd be good to take this back.
Yeah, and like talk
Yeah.
to them.
Yeah, that'd be great. Thank you.
We'll jump to Caitlin, so Jay can be relieved of her giant screen status.
Jay wants to get off the big screen.
Okay.
Hey Genevieve, nice to see you. It was lovely to hear more about your work. I'm curious whether, we're very focused on our students and hear all the time that loneliness and social isolation is a big issue. Identity, we've just been reading the Respect at Uni report that's just come out. Have you come across an implementation of social prescribing in a university setting where it's been?
Yeah, so I mean, it's an obvious thing for me to do because I've got this whole stuff going on about uni student mental health and wellbeing, and this whole other stuff going on about social prescribing. I've never managed to get the two to work together, but there is a group called I think it's SPOC, Social Prescribing on Campus, and it's led by Ruth Ann Baxter, who I met in Edinburgh. She's fantastic. So she's been doing small scale things at the University of Edinburgh, and it's just grown and grown. So now it's an online community of practice around social prescribing on campus. I think they have webinars. So if you can't find it, just message me because it's a really good one to get involved with. I've got a student at Nottingham Trent who's looking at international students in Britain being really lonely and socially isolated, and she's just done an intervention study run through their global lounge, which is like their sort of international student hub, where it sort of was not exactly social prescribing, but really looking at community assets and things that they might be interested in. So it was sort of like a starter pack where they did a workshop rather than have like an ongoing link worker, but it was similar sorts of ideas. So little trials going on, because you're quite right that a lot of students, particularly students who are doing blended or online learning, are really feeling quite isolated, even if they've got, the best lecturers in the world and the best systems. They still don't have someone next to them to go, hey, am I doing this right? Or do you want to have a coffee?
And as you said, that pathway into something like counselling or therapeutic support, there's just a vast number of students that will never take that path. So it seems
by the time they put their hand up for it, they've got 6 weeks to wait, because everyone's trying to access at the same time. So yeah, there's a lot of things, a lot of sort of pressure points in there. And the other sort of backstory to that is that loneliness is not a diagnosis, it's a human condition. and people can have it when they're in transition. I had it myself as an international student overseas, and I think that normalising that and just giving people better avenues to find their tribe, you know, they don't all need to go and see the counsellor. It's not really that. So, yeah.
Thank you.
Thanks for your question.
Fabulous. I'm just looking for any more hands.
Anna's Farmers Online. She's our
Anna.
she's our Mind Waves manager. She's in Glasgow, and she's actually in Brisbane today. I didn't know if Anna wanted to.
Did you have a question, Anna?
Or any comments, Anna?
No, is that you, Linda? Thank you for that. No, I was just thinking along the same lines as Caitlin around social prescribing in universities. So I've written down Spock to look up, and yeah, I think at CQU we've got our student Mindwave connectors, who are our peer-to-peer student mental health and wellbeing advocates, and so I'm imagining them almost as that linking agent for our students, our soft
I think
referral
100%.
pathways.
If you can get the peers to do the linking, it's going to be 100% more successful. So my little avenue there is that we started up a choir for international students after the flights opened after the pandemic. So it's called UQ Voices. We've got an Instagram page. We only had funding for 2 years. We're still going because no one wants to stop. I think we're in our 5th year. It's always a battle for funding because you've got to pay your arts people, your music people. But yeah, I think when you've got a project like that where everyone's really invested and everyone's getting the wellbeing benefits, it just sort of keeps going. So that would be one idea. But of course, choir's not for everyone. There's all sorts of other things that people could be referred into. And campuses often do have a huge number of social activities. But students often think, oh, if I didn't join during O Week, I can't join till next year. No, they don't understand that the door is open and that they should just give it a go.
And of course, in our context, you know, online students, it's another layer, isn't it, too?
Where do we meet if we're physically
That's right.
dispersed?
And we're also struggling with that, or considering that, in terms of just, you know, fast through relationships, and so yeah, that's another layer there.
Yeah. Okay, so can we jump in? I've got 3 questions. I really want to jump in with a quick logistical question, and then Andrew had one, and then we'll hear from Margaret to wrap. My question was, with link workers, finding and establishing these link workers in the communities that you're doing the research in, how did you call for them? Where do they come from, and what happens to them at the end of the project?
Yeah,
Sorry,
great
3 questions.
So I need to just sort of say my role in this is very restricted to being the evaluation person. So the people who did the advertising and the selection process and the support is Department of Families, as well as to some extent Aspire, who's doing some training and support. So my understanding is that they are quite a diverse group, different types of backgrounds. And I know from the earlier project, South East Queensland project, the link workers that were in Mount Gravatt Waste to Wellness, for instance, they mainly came from social work, community development backgrounds. In this one, as I said, very diverse. One person's got a master's in architecture and urban planning, so all the way through to, I think there was people who had done, youth work backgrounds, justice, child safety backgrounds. So yeah, really quite diverse. What happens to them after? I actually don't know the answer to that. We hope that we get more funding and they keep going, but I suppose it all hinges on, what does the government think of the findings? So who's got the money for the next time?
Yeah, I mean, that just comes from a conversation we've been having over the last few days about, research projects that are very community and socially based, and what happens, 1, to the outputs when the project's finished, and 2, to what's happening in the community when the research funding is gone. So thanks for pondering that. Andrew.
So I've got a question about the way kind of community activity is defined here. So these communities are place-based community, like it's in-person things, or are there also...
Well, as I said, I haven't had time to dig into all of the different types of programs, but my understanding is most of them are face-to-face in place. So it might be if mums and kids going fishing sort of would be one of them, or face painting in the actual community centre or something like that. I don't know of any digital ones, but that's not to say that they aren't happening. I just don't have that information.
do you just as a, I know you won't be able to like conclusively answer this, but do you have like an instinctual response to like whether there is a like some kind of any kind of difference in the kind of outcomes if you have a digital
Yeah, so this is a totally different project that we ran during the first wave, like 2020, first wave of COVID, because all the projects we were going to do in person had to stop. And it was like a big international online survey called Missing My Groups During COVID. And then my student and I analysed the music related groups, the other groups. And so we mainly had sort of choirs, instrumental, like bands, orchestras and dance groups in there. And we got people to reflect on how much they identify as a member of their group when they were meeting face-to-face versus in some kind of virtual form. And the identity was still high, but it was less high, so a significant drop. And then all of the psychosocial benefits from the group, so everything from, things like self-esteem and feeling in autonomy and being able to give and receive support from the group and sort of help emotional regulation, all those sorts of things that you get from being a member of a group. They were also still quite high, so there wasn't a huge difference, but people definitely did say, I can't wait to get back together. So there definitely was a little bit of a difference for them, even if they were still continuing online. Yeah.
Margaret. Okay, thanks, Genevieve. Really very interesting work and highly relevant. You can tell from everyone's comments. My question is really about, in terms of the referrals and the people that you're working with, your average age was about 59 in that
So
original
from Brisbane
one.
North,
Yeah. Do you have a particular focus as well on sort of aged care? The reason why is my mother has moved from Cattle Station to Emu Park.
Right.
And she just had an aged care assessment recently, and one of the questions was, do you feel lonely? It was very interesting from the assessor, and Mum's not for the faint-hearted, and she just says yes, so she's got people around her now. She lives in a town now, but she's lonely.
Yes.
And so I was, and I think that must be a real issue for a lot of people who are aged. She turned 92 yesterday.
Yeah.
So she's, elderly.
Yeah.
So I was just wondering if that's a focus in your work as well?
Well, definitely not in this current one, although we do have some grandparents who are bringing their kids along to things, but it's sort of older focus, not the focus of that particular project. Some of my colleagues have done a lot of work around social connection for older and retired adults. I've done one with a community choir in a retirement village, but that's sort of not my area of expertise. I come from sort of youth and young adults kind of background. There's quite a lot actually. So a lot of the publications have come out with older adults as the participants. And there's some really lovely stuff around arts and cultural participation. What else would there be? Yeah, I feel like there is quite a lot going on. There's a group at UQ, or they're collaborating, where they're trying to find whether a simple digital thing can help people to find activity, so be their own think, work, way, and then trying to overcome that digital divide. People sort of in their 70s and 80s feeling less confident, with the new app, that kind of thing. So there's definitely quite a lot of work going on as a solution of mine.
Yeah, because it's a growing demographic, of course.
Absolutely. Yeah.
Thank you.
And often in regional areas where, it might be cooler, something, so you move to the coast, but you might not know anyone. So it's not a number of people around you, it's not people you can tell when you need help.
Yeah, it's interesting. Thank you.
Is that everyone?
That is everyone. Thank you so much, Genevieve, for
Thank you.
answering all of our questions.
Yeah, that was really lovely and meant so much, obviously, to so many people. And thank you to everybody online who's so we're supposed to be coming back together at 10:30. We're going to have a quick break. We might just push that 5 minutes so everyone can just go grab yourselves a coffee, tea, something like that. And so how about 25 to? That suits everybody. We'll see you back in again. Thanks.
We're going to set up.
It's in here. Yeah, we got to go next door.
Hello, everybody.
Oh, that's so exciting.
Just trying to wrangle
Sorry.
your cluster lead.
Right, sorry. I'm just
Okay, if you're online, can you
I need to do the group stuff.
coming for
know me? Can anybody hear me? Yep. Okay, great. Thanks. Fantastic. Thank you, Patty, for confirming that in writing. Always feel so much stronger when writing. Okay, so this next session is actually about the clusters that are operating within Create.
you driving.
And
If you want me to,
so
yeah.
everybody's just getting in place.
Sorry, I haven't put anyone in a group, so how do I know?
Okay.
How do I
not
know who
yet.
goes
No,
through?
Not yet.
No, not yet. Okay, so what we've got is just some 1 minute pitches from our cluster leads. Just a bit of something about their cluster and what their cluster is for. And then we're going to have breakout groups and you'll follow a link through to the cluster that you're most interested in talking to or that you already belong to, and have a conversation there about you, your research, and how you fit within what's going on in that particular cluster. So, in the interest of being an old English teacher, let's go alphabetically and start with shall we? Is that all right, Linda?
Yeah.
That's all right. And Linda will share something.
So I'm going to share my screen. I'm hoping you can hear me over the the room microphone. Okay. So we are the Applied Arts and Regional Communities, the Art Cluster. A lot of our members there on my first screen. And as we are about applied arts, how do I get that? I thought I'd show you a little bit more. So here we have some of our applied arts creative researchers in their different situations out in the regions. There will be a test on that information, which has been provided to you excessively fast. And my last slide, which has a bit of activity on the side there. So this is what our cluster does. We deliver research that grows creative, healthy, resilient regional communities. We work with all levels of government and across sectors to build local creative capacity and demonstrate the value of arts and creativity. Our cluster takes a comprehensive approach to creative arts. We work across artistic disciplines. We connect arts and health, tourism, education, local government, community development. We aim to support economic growth, cultural vitality and wellbeing outcomes across all of our rural, regional, remote areas. And we hope that we are implementing and evaluating programs that develop local skills, sustain regional arts sectors and provide community-wide benefit. And some of our activities, again, in the little clip there on the side. And quite a few of the cluster are here today. So hope you'll join us in our breakout room for a chat.
Nicely done, Linda. Very succinct, despite the complexities of cluster. Okay, let's alphabetically, we're going to digital literacies and pedagogies.
Hello again. As I mentioned earlier, we really deal with anything digital literacy in any type of pedagogical environment, home life teaching, anyways. One of the other things I didn't mention earlier is we currently work with a mobile learning group where we deal with digital learning in a mobile sphere. Particularly we are very interested in how people are learning using cell phones or VR headsets, moving away from the definition of mobile being laptop. So moving that way. But we're the digital literacy pedagogy, and hopefully you will come visit us.
Thanks, Robert. Educational justice and innovation.
Hi, yes, I'm Bree and I lead EDGI with Corey. So EDGI stands for Education, Justice and Innovation. And our work is situated where education and learning intersect with justice in lots of contexts. It might begin with schools, but certainly it extends out into any organisation and community where learning and education or training happens. Our work is primarily focused around co-design and giving voice to our communities that we work with. So there's a big emphasis on innovation and translation research. Our members therefore come from a wide range of backgrounds, primarily education, health, and social sciences. So that gives us lots of scope to work, not just in our own little niche areas, but also in cross-disciplinary collaborations by wrapping our work around these three central pillars. The first one is recognising cultural diversity and social diversity. So you see our first pillar is about educating for diversity in any context and helping to break down those systemic barriers, particularly in underserved and underserved communities. Our second pillar is all about promoting rural and remote change. So we look at not just incentivising the workforce, but also building the capacities of individuals and communities and answering some of those hard questions about how we can improve regional and remote Australia, but also working with partners in international contexts who are looking at what happens in underserved communities too and how we build workforces. And our final pillar is all that around equity and access in higher education. So improving the outcomes, not just for our local students, but also for our international populations, and trying to address some of the historical and systemic barriers that have impeded learning in not just in Australian education context, but more broadly education itself. So that's us.
Thank you very much. And now over to Empower. You're still muted, Trixie, if you're speaking now.
You're muted, Trixie.
Should we like do a solo? Is it us now?
Yep. Discuss it over there.
Come up here, Karina. Sorry, everyone. We're you would have seen us on the little screen, and we're sitting there talking away, thinking that these guys hadn't started yet, and they had made a start. We were stopped there. So, as I said before, I'm Dr. Trixie James. This is Dr. Karina Menzies-Valentine, and we lead the Empower cluster, which is a cluster currently in transition, but that's a positive thing. Our vision statement, or our personality statement, is research that reimagines education for all. And our cluster is quite a multidisciplinary team of academics and PhD students. And I know we have some on the screen there, some of our PhD students and some of our members. And what this cluster is looking at sort of envisages learning more as a lifelong and life-wide journey, which comes from UNESCO's definitions
around learning, so that we don't encapsulate education as something that stops at the end of school. And we think of it more broadly in terms of learning in all sorts of contexts, local, global, and industry, school, tertiary, enabling, etc.
So the members that we have within our cluster, they're located throughout Australia, through Malaysia, which is NER, we've got Indonesia, and we have China and even Pakistan. And our research areas sort of encompass a number of various areas. In particular, we do a lot more around the global space. We do inclusion, wellbeing, and belonging. So that's some of the other key areas that we're looking at. One of the programs that we're sort of just running, and I don't think you've mentioned Rise and Shine because I didn't hear it. Yes, oh yes. So there's a few other initiatives that we are starting to do through our cluster. But if you'd love to know more, the next little chat we're going to have with everyone is just really talking ideas about where our cluster's heading.
All right, thank you. So I'll have people into breakout rooms now. Linda,
Yeah.
Prof is just going to explain this to you.
You should be able to hear me, and you can probably see me on the screen. If you go to breakout rooms down the bottom of the Zoom and scroll down to the bottom underneath everybody's names, there are 4 breakout rooms. There's the Applied Arts in Regional Communities, Corey's already joined, Digital Literacies, Empower and Edgy. If you just click the join button on one of those 4 and go into one of those rooms that resonates with you, and you'll go into that cluster. Thank you.
We'll have 10 minutes in there.
10 minutes.
Yep.
Done there.
Anybody coming into your room?
It's nearly all gone.
We're staying here, is that right? Yeah, but then you jumped in your breakout.
There's 5 that haven't.
I can't find my breakout room. Where is it? Is it at the bottom of what?
When you go to breakout rooms on your Zoom,
We're just in the big room.
scroll down to the bottom.
Join breakout. Okay, I see it.
Digital Literacies joined. Looks
Yeah.
like there's something else in there yet. So Carl, Mary and Nur, the only 3, haven't joined somewhere yet.
Is everybody in one?
No, Carl, Mary and Nur have not. Carl has Mary and Nur. Shall I just put them somewhere?
So now we'll be coming to Empower.
Okay.
Are you able to just mute the room and so we can do our group from here?
Mary Mackenzie.
Hey Joe, can you talk just so we can see if we can actually hear you? You're just coming back in.
How about now?
There.
Can you hear me?
Yes, thank you.
You can go back in the room. Anyway, Trixie, if you want to, or you can stay out there, it doesn't matter.
Okay, no worries.
So people are still in their rooms.
Well, it's closed. They should all be brought over there.
It's not quite done back down.
Can you see them? They're still in their room.
Oh, that's very cool for a professional.
Oh, no. Probably at the point where I'm going to have to actually have a paid account.
Well, I did press close all rooms. So I don't.
Is that because I put them in there? Do I have to do something?
Yeah, you have a look. See if you've got the button to close all rooms down the bottom. You're applied arts people. Can you ask them to come back in? Oh, you want me to ask them? Yes, please, because they're more.
Oh, do you want me to go out there and tell them?
No, in the digital
Oh, in the
thing.
applied. It should kick them out.
Yeah,
in a
but
second.
I put them in.
The time's up. So
Well, why
How
are
are they still there?
They're still in there.
Yeah.
I'll just move
they're
it.
caught. They're caught in
Move to.
It's trapped.
No,
Don't
I
finish
the
can't.
actual environment. I know they're back in here. I don't know what's going on.
Well-
I think we've got everybody now.
Or maybe that's just where we assigned them to.
Yeah. Anyway, next session. Just let me share something.
Sorry, it's only showing me that.
Last session of the day. Share. Okay, so our last session is focusing on building a research trajectory. So what can it look like? And we thought, what's the best way to actually is to illustrate this to people? And we decided that we would invite two gun researchers from across the university to just have a bit of a chat about their own experiences, stories. What was it that helped them on the way? Where were the opportunities? What was the journey like? So I'm just going to introduce her. Amy has asked, Grace, I hope this is all right. Amy has asked that she needs to go first. She's got another meeting to go to.
Sorry, Grace.
So I'd like to introduce Associate Professor Amy Cosby. She is at the moment the IFS Acting Director, and she's lead of the Agritech Extension and Education Cluster. And so works sort of, and she's your mummy. There is no doubt about that. And works, we've got loads of areas in common, and the Agritech cluster sits sort of within Create, but yeah.
Sorry, Joe, I didn't get to respond to your email, but I can give a little overview of Agritech Education Extension as well as part of this, if you like.
Fabulous. All right, so let's kick off with you, Amy. I'll stop sharing in case you've got anything. Doesn't matter if you don't.
I don't, sorry, but that's all right. I prefer to see people anyway. Hi, everyone. Some familiar faces. My name's Amy Cosby. As Joe has already introduced me, I'm actually based down in Gippsland in Victoria. So my husband and I are dairy farmers, which is why we're down here. And our claim to fame of where we live is the same place as Erin Patterson, the mushroom murderer. So we're just around the corner from the tip. And if you come down here, I can give you a tour of the key landmarks. I started at CQU in 2018. I did my PhD at the University of New England, but in more ag tech space, not education and extension. But I realized I was a shit scientist and decided that I liked working with people much, much more. So I have never worked in Queensland. So I have had to develop my area of research and my team remotely. So I think that's been a challenge, but also a great opportunity. Our Agritech education and extension research is focused nationally. Sorry. We have brought in about $7 million of external research funding since 2018. We have industry, government, grants, working with private business across the education continuum. And I've been in meetings all day.
Water,
I'm losing my voice. Where's my other older children when I need them to go fetch me things? So our research falls into 3 areas: education, which is around, I am going to have to get water. Sorry.
You're right.
Sorry.
You're right.
So our education research is focused on 2 key areas around how do we teach young people about where their food and fiber comes from. So we realize that not everyone's going to have a career in agriculture, but everyone eats food and wears clothes every day. So it's really around maintaining our social license to operate, as well as education, because agriculture or food and fiber is in the curriculum. And then the other side of it is around career development and attracting young people in particular to the ag industry. So we've had a national a career grant that was excited for careers in ag, which was quite a large project across Australia. With Corey was on our team that was focused in that area. Our second area of workforce is around attracting as well, but probably from an adult perspective, retaining and developing talent within the agricultural workforce. And also we have quite a few projects on diversity in the ag industry and specific sectors, as well as projects around how people learn, which is obviously really falls well into Create. And then our other area of extension is probably more that traditional behavioural change around how we get people in agriculture to adopt technology and change behaviour. So, for example, at the moment, one of the projects we're looking at is silage plastic waste in dairies, which is pretty topical for me, around how we can recycle that. And we're forming up a bit of a project with Solving Plastic Waste CRC and MLA in Dairy Australia. So that sort of gives you a bit of an overview, and you probably can see from that we have a lot of synergies with Create, a lot of opportunities. We do both quantitative and qualitative research. We have about 8 people in our team, and I supervise about 8 students. So across all of those different areas. So, Joe, is that all right? Did I miss anything?
No. I think that's good, Amy. Yeah, that's a good overview of what you do. Yep.
Cool. And then I guess my career trajectory, like I said, came to CQ in 2018 on a 1-year internal grant with my PhD supervisor, previous PhD supervisor, Mark Trotter. So he moved from UNE to CQU, and I moved figuratively because I am still in Victoria. So we had a 1-year internal grant that we also had some funding with, it was GPS cows from New South Wales DET and the Queensland Department of Primary Industries. And I guess from there, I had to apply for lots of grants to be able to establish, a longer than a 1-year contract, and also a team. So I obtained a Women in STEM grant. So I don't know, I think, Linda, you put one of those in the other day, the STEM and entrepreneurship grants. I had one of those in 2019 for 2 years, Women in Agritech. And I think that was like the launching pad for me, because we had Bobby Harreveld was on that grant, as well as Sally Ferguson. So it was my first foray into other areas of CQ that wasn't just, I guess, ag and livestock and mark. So that was really great for me. And then from there, we really, I met my work wife, Jamie Manning, she was on a tarmac on a plane in the Sunshine Coast, and so was I, but I was going somewhere else, but we both got stuck there in a storm. We're just texting each other from the plane, and she was here on a 1-year contract too. and a year after me, and we had similar interests, and we have then applied for, lots and lots of grants and been quite successful in establishing the Ag Education Extension Cluster. So I have been leading that cluster, I guess. We probably established it in 2019 and became a level C then. Or applied for promotion. I think I was a level C. Oh no, I didn't apply for promotion. I got a contract as a level C, sorry. And then I've got 3 children. You've seen one, you can probably hear the other one. I've got Oscar is in 2020, and then I had Zave in 2021 and Noah in 2023. So there's Oscar. He turns 6 on Saturday, but he's got a day off school. And then I became an associate professor in 2022, maybe. And then in 2024, 2025, I've been the interim director for the Institute for Future Farming Systems at a professor level. So I guess I've had a fairly dramatic rise, maybe, of career progression in the midst of having 3 little kids and creating a team. And I think I said previously, we've got about 8 members. Everyone but Jamie is on research money. So, yeah, go away. They know that when they're doing things, if they can pester me enough. Yeah, so that's, I guess, a bit of a crash course. Grace, I've seen yours. You'll go get it. I've seen your slide that Sally shared that's much more eloquent than my presentation. So I'm glad I'm going first, and then people can see how it's done. But yeah, I guess I'm happy to answer any questions that anyone might have. I don't know, Joe, if I've missed anything.
No. But Amy, what time have you got to leave? Because if we've got some questions, sort of, do we listen to?
Oh no, it's fine. I told Jamie that I would be late to our next meeting, so I've got a couple of minutes if you want.
A couple of minutes, all right. Look, from my perspective, it sounds like some of what you did was serendipitous, but a lot of it is not. Okay, so the meeting of Jamie may well have been serendipitous, but how do you go about, for those people who are starting off, how do you, as a young person coming out of the team, then work your way into being the person who decides what the team is and where you're going?
Yeah, so for me, it's always been about being part of the industry that I want to be undertaking research in, so that I know what the problems are and what is needed, what research is needed, and being seen as someone to go to. I probably didn't say, like, at the start, it was only myself, and I think I would have probably been at about 2.5 FTE of external research funding. So I didn't have kids. So we had a dairy farm though. So that's, if anyone knows what a dairy farm's like, it's not exactly a easy job. So it was around doing the things that industry needs and wants, even if it wasn't, you needed to be flexible and you needed to be seen to be listening and able to solve or contribute to solving their problems with them. So we always conduct research with our partners and with our target audience as opposed to for them. So it was really important to listen and to just develop that reputation of, if you've got a problem in ag education, workforce or extension, you come to CQU. And it's around making sure that we promote what we're doing. And so our team, for every activity, new grant, new publication, new research activity, we're putting them on Facebook. We've got I think about 3,500 people on our Facebook page that we share with very regularly. Any activities or new grants, we would get CQU Comms to write a press release. We're regularly in the media. One of the big projects we did that was unfunded was our Ag Knowledge Survey. So in 2021, we surveyed 5,000 people across Australia, primary and secondary school students across Australia. And we are now known as the it's the largest report about food and fibre education ever conducted in Australia, and we're about to try and do that again in 2026. So just doing things that being part of the industry, attending lots of conferences, lots of workshops, virtual or face-to-face. Noah has done 98 flights, so he's 2, so he's a fair, like that should give an indication in 2 years. There's a lot of getting around and getting out there and being, just known as useful and helpful and willing to listen. And we're not there to tell people what we think, but design research that's going to meet their goals.
And so there's a fair bit of research translation that goes on in your projects. It's not, you are doing the academic work of producing papers, etc. But then there's this other component.
Yeah, and I didn't have a very good publication record until probably the last couple of years, because nobody in agriculture in the space I'm at is focused on academic publications, and we're never going to be applying for DECRAs or linkages or anything like that, because that's just not where our strength lies. I guess so I've picked that industry route and government funding that's not necessarily those big cat ones.
And clearly it's quite a successful path. So
so far,
does anybody else have a question for Amy? Yeah, Corey.
Hey Amy, it's Corey here.
Corey, I can't see you in that room.
I'm in the room.
Okay.
Look, I think what I value is a bit more insight into how you have built your research teams. I've always sort of admired the way that you can pick not just people who have the skills and capabilities that you need to do the work, but also the people who can fit in with how your existing team works and how you sort of, bring them on board and, get them to work together. That's a real standout for me in seeing your work.
Yeah, so I would always pick over personality and fit with the team over skills. So it's really important I have a no dickhead policy. And I learned that really early on in my career at UNE, as an undergrad student doing work with some techos, and it served me quite well. And I want to be able to, I don't need to be friends with everyone in my team, but I need to have a friendly relationship, because I managed a team from this couch, and anyone that's met with me before knows the couch. So I need to be approachable. I need them to know that they can be comfortable to talk to me about good things or bad things. So having that, we've just hired, and it really was around, you can teach skills and how we want to work, but having that personality fit and having that same shared vision and goals, and knowing that they're vital members. Academia is fairly hierarchical, but in our team everyone is equal, and we have a team meeting every Monday. We have a Facebook group chat, messenger chat. I always try to find out something personal about each of my team members, so I've got something to say, like, oh, did you like four-wheel driving on the weekend? Was it good weather? Did you have to really things that aren't they're like the 1%ers that add up to a lot and show importance. Does that answer your question, Corey?
That's good.
Yeah, thanks, Amy.
Easy, no dickhead policy.
No dickhead policy. We could write that.
I also like to say, do I want to have a beer with this person? But I actually don't drink beer, so it would have to be, do I want to have a wine with them?
Is there anybody else online? Perhaps who just wants to make a comment or a question for Amy? There's so much more in your story than just what you've been able to tell us too, Amy, So, we can point you to things like the Facebook site.
Yeah.
Our
website. We've got a website, agritecheducation.com. A lot of people, and the web has been really key, because if you Google women in agritech, which is a fairly, obvious, our site for our project is the first Google hit. It's the top hit. And it was because of that last year I got invited by DFAT to present at an APEC conference in Thailand because they saw us as the leaders in women in agri-tech. So I'm not quite sure if that's the best research strategy, but that was a good one.
Yeah, okay, thank you. Good, thank you very much. And feel free to hang around if you can.
No, I've got to go, sorry. But nice to see you all. Sorry, Grace, I'd love to listen to you speak, but I need to race to another one.
Thank you.
Thank you.
See you.
See you later. Bye.
And so now I'd like to introduce Associate Professor Grace Spencer. And Grace is with the Appleton Institute, and I'm sure that she's going to tell us a bit more about the complex work that she does. So welcome, Grace.
Thank you, Jo. And thanks, everyone. It's, really good to be here and see some familiar faces online. I've got a couple of slides, so I'll just share my screen. Jo, if you can just let me know if you can see them when I just press the go button. Can you see that now? Okay, cool. So I've just got a couple of slides outlining my career journey. So for those of you that don't know my research area, I'm a sleep researcher at the Appleton, and my research is mostly focused on sleep and work. So shift workers, people with irregular hours, and do a range of different projects in the lab and out in actual workplaces around trying to improve workers' sleep. Part of that has been creating evidence-based resources for shift workers through a program called Healthy Shift Work, and really just trying to bring together all of this really rich evidence-based information into resources that are really accessible to people that are, doing shift work or working shift working lives. So bit of a random journey to get to that point. So I'm originally from New Zealand. A few of my words are still very Kiwi, and did my Bachelor of Science at Auckland University in 2011. Was actually in a super different area, looking at one-legged cycling and the changes in muscle, which is so weird because I do nothing to do with that now, but it was a really great introduction to research. And during that time, I was a semi-professional football player, and ended up playing soccer for New Zealand, including at a World Cup. So I was studying and playing sport at a high level. And during my honours year, my honours supervisor, unfortunately, was tragically killed in a cycling accident. And that was a really big game changer for my life in general and my research career from that point. In the bottom left of the screen is a man called Tony Fernando. And during my whole undergrad, I only had one lecture on sleep. But I remember just finishing that lecture and thinking, wow, this is so amazing. And I was so fascinated by the topic. And he was such an engaging presenter that it had always really stuck with me. And after Hans, my honours supervisor, passed away, I started to look at other opportunities overseas, and a PhD opportunity came up in Australia at Deakin University in Melbourne. And it was about bush firefighters and bushfires and sleep and how firefighters sleep during bushfires. And I thought, wow, that's pretty cool. I'm going to get into doing sleep research after my only background was that one lecture in my undergrad degree. So did my PhD at Deakin University, which was a great time going around different fires. We also did lab simulations where we, simulated firefighting tasks in the lab and sleep deprived firefighters. So it was a really great training experience. Went to various conferences around the world and ultimately was, yeah, just a really great foundation for my research career. I then had a year of various internships at Monash University and also at Washington State in the US, which were also great just to further my skills, and then was fortunate enough. Oh, yes, so these are some photos from there. So beautiful place. There's a story about a shredder, but that's something I'll probably tell another time if you have a wine with me. So we'll leave that one there. But yeah, a really great time. And yeah, just an awesome experience. And then was lucky enough to get a postdoc at CQU. So that's how I ended up at CQU. And Sally Ferguson, who many of you know is the director of the Appleton Institute, she was my associate supervisor for my PhD. And then she had a postdoc going, and who wouldn't want to work with Sally? So yeah, ended up in Adelaide doing a postdoc in the lab here. And again, great experience doing that postdoc, working in the lab. You know, I like including these photos because I think for me, it's always been about the experience and the people, and, you know, work being really important, but, you know, life being important as well, and really using those things together. So in 2019, I moved into a research fellow position, and was successful with my first ARC grant. And so this was a grant that when I was at Washington State, I remember I was on a run and I thought, oh, this would be something really interesting to write a grant about, and then sort of pitched it to Sally during my postdoc and then worked it up as an ARC project. So I was pretty junior at that point still. So Sally was the CIA on that grant and I was the CIB, but it was a great opportunity to get some really big research funding and really set again a great foundation for the rest of my research career. During that time I also had my daughter Ella, and so had 11 months off maternity leave. So with that ARC grant, I think it's always important to note that, you know, you kind of see, oh, that person got all that funding, but which was a lot of money. It's just over 600K, but we put that in 13 times in various forms, some smaller grants, some bigger grants. We had applied for the same ARC funded grant scheme the year before and missed out. So yeah, I think often you kind of see the successes, but you don't see what's behind that. And there was, a lot of different funding. So yeah, that project started when I had my daughter. So the team made a little head RA, little top for my daughter. But so that was another challenge, starting, what was the biggest project while I was on maternity leave as well. So following that, I moved into a research-focused position within the School of Psychology and coordinated our honours program for a few years with the wonderful Amanda Rebar, who some of you would have known from back then. And during that time, had my son, Jack. So I've got, two little people. I then had my first grant as a CIA, which was an international grant related to co-designing these resources for shift workers. And then in 2024, moved into the postgrad research coordinator role within our school, which is now those relabeled to the grad research leads. And was promoted to level D in 2025. In 2025, it was a good year. I was successful with the ARC DECRA and also a ARC discovery project, this time as a CIA. So there's a few steps in between there with a lot of unsuccessful grants. I think when I went for promotion, they told me that I had applied for, I think it was $45 million in funding, and I have 4 million. So that's a pretty low success rate, really. But I think it kind of speaks to, I guess, the hustle that was sort of required to get to that point. So at the moment I'm working on my DECRA and getting this big project up and running. So my main learnings, and this is just my last slide, is around how I make decisions about whether I'm going to do things or not. And I think early on in my career, it was very much saying yes to everything and taking opportunities. And as I've gone on, I kind of have this very values-based framework to making decisions. And they're around these 3 things. So do I like the people? Very much agreed with Amy's comments there around a no dickhead policy. And that's a real key one for me. So do I like the people? Is it fun? And does it move me towards my goals? I'm not the kind of person that has a 5-year plan around where I want to go. I've just never really been like that. But I do have short-term goals and things that I really want to achieve, probably more in sort of a year-based framework. But when I'm making a decision about whether to do something, it has to hit 2 out of these 3 things. So sometimes there are things that you do that, move you towards your goals and you like the people, but it's not necessarily fun. Things like joining the university research committee. Does it move me towards my goals? Yes. Do I like the people? Yes, they're great people. Is it fun? No, definitely not. So I kind of have this similar framework to everything, and it's kind of just set me up really well because when an opportunity does come across, you can really take the time to think about it, and it's based in something that's really solid for me. And you might have, obviously different values, but I think having a bit of a framework around, what to say yes and no to can be really useful. And I think more recently as well, I've thought about not just trying to fill my time with lots of different things, but thinking about what energy tasks leave you with as well. Particularly, I've still got 2 young children that I'm racing around with, and having the energy at the end of the day to engage with them and not just trying to fill my day with lots of different things. So that's a little bit of a whirlwind insight into my research journey, but happy to answer any questions.
Thank you, Grace. That was really interesting. I just wanted to say that sleeping and sitting could actually be my life story. When you're knocked back from things, you had that list there. We went to research leaders the other day, and they're pointing to unsuccessful grants and the rates of unsuccessful grants. We came back as a leadership group here, and the last couple of days we've been talking about how we reduce that. Do we flip that and say, in fact, the unsuccessful grants are wonderful stepping stones towards the successes themselves? And so how did you, when there was that list of, it doesn't look like we're getting here, how did you keep going? What were your, how did you sort of go to the next step? What were your thoughts at that time?
Yeah, I think that's really important, Jo. And it can be really, can start getting in your head and thinking, oh, this isn't a good idea. This is never going to get funded. And honestly, when you're up to, I think if that one hadn't got funded, I probably would have let it go. And lucky enough, it got up on that last go. But I think, it is, I do see it as stepping stones and reinventing things, taking on the feedback, if a grant, body provides feedback, which, that's a whole nother conversation, but they should provide feedback, and being able to, continually refine the idea. I'm not sure if now I would kind of have been that persistent, but I think early in my career, if I look at the first few applications for that, idea, I can see why it didn't get funded, and just persisting with it, really did make it a good end product. But yeah, it takes time to kind of push through there. But yeah, I think the unsuccessful part is part of this journey. You know, I've got a whole spreadsheet of every single grant I've applied for, and they're that same color coding system, and it looks pretty red. Like there's very few little green spikes. So yeah, there has been a lot going. Yeah.
Yeah, the successes are large too. So yeah, Linda.
Hello, Grace. Well done. I've been listening to you and Amy and having babies during your journey. I had babies during my, I didn't work at all, but during studying my doctorate. So I think it's wonderful that you both can have careers at CQ and they can support women and families. So that's the first thing. And I noticed with both of you, people first. And I try to do that as well, and partnerships, people in your team, obviously, and people who you work with. How do you convince, I guess, or with not necessarily workload, but partnerships take a lot of time and it's not visible time. At least with the unsuccessful grants, you've got the data, you've put in for those, you didn't get them. What advice would you give to more junior researchers about taking that time? Because partnerships can take 2, 3, 4 years. And in the meantime, while you're building that partnership to get those, those things happening, on paper, you're kind of not doing anything. So, what sort of advice do you give to people, I don't know, on how to manage that?
Yeah. Thanks, Linda. I think the partnerships part is really critical, because often that's how, with many of our grants, we need to have partners, relationships, you're established in communities. Amy talked a lot about that as well. And I think taking the time to really build those is really important. And I'd almost say probably more important than, hustling for an extra paper, or, putting in another smaller grant. But yeah, it's really challenging. Time is, a finite resource. So yeah, it's kind of hard to figure out how to sort of strategically figure out where you're going to get the best bang for your buck. But I do think the partnership side of it is important, and building those relationships and being available. Amy talked about that as well, but, a partner saying, oh, we're going to be doing this presentation on Friday. Could you drop into the meeting and have a chat? The kind of ability to be able to do that and be agile, I think really goes a long way when you're, trying to include them on something or get something from them really quickly as well. So yeah, I think I would see that part of it as being really, really key to a successful research career.
Sorry, I just saw Patty's comment. Do you have to have babies?
It's not compulsory.
Yeah.
Correlation, not causation.
Yeah.
Other questions? Other comments? Andrew.
I just have a quick question about the timing of the DEPRA and career. So is the career interruption? I'm assuming you had career interruptions for maternity leave. Was that? Were there any other career? Because I'm just working out the maths on timings. Were there other career interruptions, or was it just the maternity leave?
So I had 11 months off for both my children, and then I came back to work part-time in between, so I was only 0.6. So yeah, I think when we worked out my eligibility, because I actually was going to go, that was my second shot at DECRA, so I applied quite early on, and I think some of the research that some of our colleagues have done around here around timing of DECRAs is, you either apply right after you finish or right at the end. That's where the majority of people are successful with DECRAs. So yeah, I think my eligibility, I was in by about 3 months So yeah, that timing worked out well. But yeah, I think the difference between the first time and the second time was mostly around my project. The first time I was in the top 10% of unsuccessful applicants, but I completely redid the project the second time around and made it a lot more, I guess, contemporary. It was on AI. So yeah, it was right in the zone of kind of being interesting and novel and innovative, which I think ultimately made the difference.
Thank you. Sandra, anything else? Anybody online would like to ask anything? Grace? No?
I'll just make another comment. Sorry, I'm with that, your very first ARC, and you were CIB and Sal was CIA, when we were at Research Leaders, she was presenting, she did make it known that it was all you and all your project, and basically she was just on it by name, for that, and which is great. What sort of advice do you give to people in this cluster as well? How do we, so we've lost a lot of our professors and Ds and Es and that sort of level in our school, and the heavy hitting research professors and more experienced researchers. So what sort of advice do you give for people in Create to have those sort of successes and the Sally Fergusons, of the world, that, what sort of advice do you give for us? I don't know. How do we get
yeah, and that's been I have been really fortunate to have that mentorship, and one of our colleagues described it as being, you're a pilot fish attached to a shark. So Sally will be my shark and I'm the pilot fish, or at least that's what it was like. And for a long time, and that's been the same with a lot of how our group has operated in those really junior stages. Sally will lead the grant by name, but just because we know that that's going to result in a higher success rate, and that would rather get the money to then be able to do things, to progress things, to keep people around, than it would be to not. Without having that, I think probably the main strategy is trying to build collaboration with other, national collaborators or international collaborators, or at least having them. They might not necessarily need to lead, because then that has implications for where the money ends up, but that they're embedded, and that they are meaningfully embedded. And some of the ways we've done that, particularly we're trying to build our international collaborations, is having internationals involved in publications and showing that we have a track record of working together, and then having them named on applications as well. I think it just speaks to credibility of programs, and that they're willing to put their name to something as well. So I'd say without direct sharks, best to kind of connect in with other people, and I guess the other way to do that is show that industry leadership and the partner side of things as well, connecting to big people, getting references or testimonials from partners, mostly just around just adding the credibility to the story.
Yeah, thank you. That's good advice.
All right. Well, thank you, Grace, and thanks from all of us for making time to come and talk to us today.
No worries at all. Thanks for having me.
Thank you.
Bye-bye.
That's great. Are you thinking of a decora? Sorry, that's
share just one last thing.
No, I don't think I'm
going to do a bit of feedback. So one of the things that we were considering was, from listening to both Amy and Grace, then some questions that you could be asking yourself are around, what was noteworthy there in terms of your journey, but and what key messages there, and there are numbers of them around partnerships, there, about promotion of what you're doing, about looking for the right kinds of partners, And what does that mean for you? Where do you go from here? What are the partnerships that you can form? Where are you now? What expertise do you have? If you wanted to actually move in a particular direction, where could you get that expertise from? How do you see your trajectory? How do you talk to yourself about yourself?
How do you talk to yourself?
I don't know. I do that a lot. How do you talk about yourself in relation to research? You know, how do you promote what you can do and, you know, how you can be useful to others? And then thinking about what your next steps are. And, you know, we were talking yesterday about what some of the questions could be and, you know, this. So do you need publication? So what do you bring to the task? What else do you need? Do you need to do it with other people? Are you moving towards, you know, you would like to work in research teams? How do you go about doing that? Who do you publish with in order to strengthen those teams? And then what do you still need to develop or access? And how will you do that? So these are some of the questions, I guess, you know, as you're beginning or you're in the middle of your career, taking some time to actually think about where you are, you know, in this picture and using those messages from both Grace and Amy about, you know, how you can progress, I guess is probably of interest. So to wrap up today, Linda Lorenza has created I'll start sharing now. Yeah, a Menti, what's it called?
Mentimeter.
It's a Mentimeter. So would you like to introduce everybody to that?
Sure. So let me just see if I can share my screen. We've just got 3 slides to go through that will give us the your feedback and what's coming to you on from today. So that's what it is. I just need to share it to you all. I'm trying to find it just share. Okay. And the blancmange of my screen will disappear, and there it is. So you just need to, oh no, where's the code? Can you see the QR code? No, where's the QR code gone?
It was on the slide.
Hang on, let me just go to the next slide. There it is.
There.
So if you can please scan that QR code and then get ready to type. Is it? Type text from your device. And as soon as everyone's got that code or the number, I will jump back to the previous slide. Yeah, so this is your first slide. If you could just scroll. If you're interested in those 2 things, keen to collaborate on a grant application or keen to collaborate on publication writing. Yes, that's yes. Everyone's keen to collaborate. Excellent. Oh. Grants or pubs?
Grants are winning. I feel like I should be betting, sorry.
2 horse race.
That's right.
Out of 50. I don't think we've all done it, but that's all right. Great. Okay. And then the next slide is open-ended response, anonymous. So don't worry, we won't know what you said. And already people have started putting some ideas in here. Thank you.
That'd be fun.
Okay, say, yeah, Linda can say.
So there's lots in there, Joe.
Yeah, lots.
Last slide. So far today, I have appreciated positive feedback.
Did somebody write no tickets? I was going to like it.
Yeah, no, that's great. Thank you. And look, we have been in planning days, actually planning days for the last couple of days, and some of the things that you're mentioning there are that you need or you'd like to be involved with are really on our radar. But we will look at that data properly now as we progress ahead. So I'd just like to thank you all for giving up your time today. You know, it's sort of tricky, isn't it? Even though term hasn't started, you know that you're still doing an awful lot of work to prepare for set term. So, you know, it's really great that you can make the time. Anybody else here want to say anything before we wind up? No?
Just thank you, Joe.
Yes.
Yeah, for leading everything. So, thank you.
Yeah, and enjoy the rest of your day. Have 4 minutes back. There you go. How kind are we? See you, everybody.
Thank you so much. Bye.
Bye now.
Oh, by the way, just as I was coming through the kitchen, Deb Nab